most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Surgery for your knee arthritis? Not so fast. We're going to show you 8 best exercises of physical therapists, and hopefully this will maybe buy you some time.
Right.
Maybe it'll buy you years. It's really very possible.
Sure.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to bobandbrad.com, go to the giveaway section, because we're always giving something away. We have a giveaway contest where we're giving away a Booyah Stik. You can also find the contest. They'll be pinned to the top of the page of Facebook. And if you go to Twitter or Instagram or TikTok, you get a 60-second version of our program.
There you go.
Brad, this video is actually for a former patient of mine. He's been having some trouble with his knee. I know we showed you some exercises, but we're going to show you a few more maybe here, or at least condense, have them summarized.
Sure. So
that he knows what they all are. I know also I've talked to you about using a walking stick or a cane. And I don't know if you're still doing that, but if your knee is still bothering you, I'd still like you to go back to that for a while.
Reduce the weight bearing.
Yeah, I'm going to mention a couple of ones that were sent to us by a company here. We have no relationship with them, but I thought I'd just mention I like their Prime Stick. This is actually a walking stick that they use. It adjusts. Yeah, you can make it any length you want, and it's just easy. You just twist it like this. And it's lightweight. It's got a good handle. And yeah, you're uneven there, Brad.
Yeah, that's all right. I've always been that way.
They also came out with a cane. So that's called the Prime Stick. This is called the Cyclone cane. I didn't like the adjustment on it. I got to be honest, Brad. I thought the adjustment was a little onerous, a little hard to do.
Yeah.
But once you got it in place, it doesn't matter.
Right. You only adjust once.
A very comfortable cane as far as handle.
I really like the
best handle I've seen. They recommend you actually have the handle out like this instead of like this.
Right.
Interesting.
Which I like
think
it.
Ergonomically works better. Not set for me right now. But,
no, it's a little short. Let me try. Yeah, it's good for me.
Yeah.
Yeah, it really has got a nice grip.
All right, let's go into the exercises. The first one, and I think you're doing this one already. I don't want to use your name because I don't know if people.
No, you better be stealth.
The first one, you're actually going to do. I know we talked about that. I don't want you to sit with the knee bent more than 90 degrees. So if you're like this, I don't want you to sit because he works at a desk a lot.
Oh, sure.
I don't want you to sit with it. And he said, yeah, my doctor told me that too.
Yeah.
Because this actually is putting pressure on the knee all day long. So you want to go ahead and have the knee out like this sometimes, or maybe just like this. But every so often, you're going to do active knee extension.
Yep.
5 times. I'd like to see you probably do both knees just 5 times every 30 minutes. And this is just getting some movement in there, getting some fluid in there. It's just a great one to do. It doesn't take very long. You can actually keep working while you're doing it.
It's good for circulation, strengthen the legs.
Now, if you're on the opposite end of the spectrum and you're doing a lot of standing for some reason, Brad, if you're standing up for a long time, your job requires it, then I want you to try to sit down every 30 minutes, and you're going to flex the knee. 1, 2, 3.
The idea is to keep things moving
4,
and don't be in a static position for long periods of time.
All right, so that's the first 2. The next one, if you're lacking some knee extension, your knee doesn't completely straight out, especially if you compare like one knee that's worse than the other. All right, if I put this knee up and you can see I have a little bit of a bend, this one goes completely straight. You're going to want to work on that extension. It can be very subtle, by the way.
Sure.
It can be very minimal. Like to the trained eye, it would take a trained eye sometimes to pull it out.
Right. Bob's exaggerating so you can see it.
So what you're going to do is you're going to work with that knee. You're going to do pressure on. You're not going to push right on the knee itself, but I push right above it. Pressure on, pressure off. Pressure on, pressure off. 6, you can do that for 10 times. Yep, you can do it on a bed too. 6 to 8 times a day. This is a really important one because we have found if you regain the extension, quite often what happens is that the pain level goes down. They seem to coincide.
So I'll just show you can put a towel roll underneath your ankle. That gives you a space if you're doing it, in bed. You could put a towel, not a towel roll, but a towel
Underneath my heel.
Yeah, just to make it more comfortable.
Now, let's say you're doing this. It's just not helping. What I want you to try is either turning the foot out or turning the foot in, and then do pressure on, pressure off. See which one feels better. For my wife, it was turning it out a little bit, and she did pressure on, pressure off like this. It took time, but she really had good results with the knee. She's back running again, like we just mentioned in a different video. Kind of really almost a semi-miracle, because I mean, she was to the point where she was using double crutches. I mean, she was.
Did you get credit for this, Bob?
Yeah, she does. She does give me credit. But it's funny. I just remember her crying in the bathroom, like, I don't want a knee replacement. And I'm like, you're not at a knee replacement yet. And
I hope she doesn't. She doesn't.
I know she doesn't either. She's not going to be happy with me. So anyway, try one way, same thing. It's going to be 10 times, 6 to 8 times a day. I know you're going to say, are you kidding me? I can't be doing exercise that often. Well, then you're going to live with the pain. I'm sorry.
And they don't take that long. 10 times, it's going to take you 30 seconds.
Yeah, it's going to make a big difference. Now, let's say you're one of those people that's lacking bending. So I check one side and I check the other side, and it doesn't bend as far. All right. In that case, what you're going to do is the same thing, but pressure on, pressure off with the bending. And again, 10 times.
And the nice thing about this one, you can do it laying down. You can do it in bed. You can go on the floor if you'd like to. You want to show the
show the towel. If you're not making gains on that, what you might do is take a rolled up towel, stick it into the what do we call it? The knee gap?
That's the popliteal
fossa. I was trying to think of that. And then I was trying to think of the layperson term. I couldn't come up with either. So this actually kind of gaps the knee. It actually feels good. It's a great one to do. When you are comparing one knee to another, you may not even hardly see it. Like there's a lack of a bend there, but you'll feel it.
Sure.
Like you'll go, yeah, that one just doesn't go as well.
You can actually put your hand in there like this and do it. It doesn't work quite as well, but you get some benefits from that. Just an option.
I'm going to show you one more variation on that too. So I'll show it in this direction here, actually toward you. This is an advanced one. So what I'm going to do actually while I'm bending the knee, I'm actually going to turn the knee, the lower tibia and fibula, out this way. I'm going to turn it, and while I'm turning, I'm going to bend the knee. And I'm holding it in the turn the whole entire time. The only reason I bring this up is because some people have really had good luck with this. So I'm twisting it the entire time out this direction. If it was this leg, I would twist it this direction. All right?
Yeah, that one is a little advanced. I've had patients, it's somewhat tough to teach some people.
Yes.
Because you're not, you're grabbing the tibia through that flesh and whatnot. But
the only reason I'm doing it, Brad, because some people have really had good luck with it. I just hate to not to mention
so
it.
You'll know if you do it because it's going to feel good. It's going to be very obvious that you can get more range.
All right, then we're going to start you with some strengthening. So like in the McKenzie book, which a lot of this is from, by the way, How to Treat Your Own Knee.
Sure.
Robin McKenzie. What they actually do is they have you take your chair up to a door. Let's say the door is this way, Brad.
Mm-hmm.
And you can actually grab the handle and start doing sit to stands like this. Now, you certainly can do this by a sink, too. Just grab on the sink or a counter.
So if you're strong enough to do it without that, you
can. Well, what they want you to do is quite often is pull yourself up and then lower yourself down. So you're doing a little bit of eccentric strengthening.
Sure. Yep.
But very soon, if that works pretty well, you can then progress to just doing squats without it. So you can just do them like this, or you can even do push-ups.
Sure.
Push up if you have arms on the chair. You can do them prisoner squats.
Oh, prisoner. That's a little more aggressive. That's quite a bit harder.
Right, and eventually you can even go to the point where you start going down and don't touch the chair.
Sure. It's nice to have the chair behind you, just in case your knee gives out or you lose your balance, you don't fall.
Right, and the whole thing here, we're trying not to flare up the knee. Don't do things that are going to make it worse.
Right.
So, Brad, we're already at number 8. We made it.
8.
Well, I know you like 7.
I know I like 7, but
And you know what I did? I
Eight's
added
just
one.
one
I added
more.
one just to bug you.
oh really?
Yep.
Okay, show me.
Well, no, that was it. Number 8.
Oh,
I could have done 7 plus 1, a
We are-
bonus.
we are really in tune today, Bob.
Yeah, right. All right. Enjoy the 8. Thanks for watching.
Oh, we did it already.
Yeah, we did it.
Oh.